From the studios of the Department of Communication in Phillipsburg, welcome to Prime Minister Talks with Honorable Prime Minister Silveria Jacobs.
Welcome to Prime Minister Talks. I am Silveria Jacobs, and it is my pleasure to be able to come to you today with a special program. I don't have a specific guest with me in the room, but in discussion with my team and looking for ways to ensure that the people of St. Martin can remember even some of the most important things that have been said on this program related to COVID-19, we felt it pertinent to bring back some of the important guests we've had related to COVID-19. And our first is epidemiologist and head of CPS, Ms. Ava Lista de Weaver, who in our season 1, episode 31, had this to say.
Over the course of the epidemic on St. Martin, source and contact tracing has allowed us to piece together where certain persons could have become infected with COVID-19. So it was at this point, I think the public was aware of the term that we use in outbreak investigation called a cluster. And so a cluster by definition is an unusual aggregation of health events. So in this case, 3 or more cases that are grouped together in time and space. And so when we look at our data through our in-depth source and contact tracing, in the summer, it was clear that our resurgence of cases that we saw was directly attributed to the nightlife sector. And I say this not to intentionally target a particular sector, but this was what our data demonstrated at the time. And when I look at the current epidemic now, it's clear that our clusters are occurring across various sectors. So that is supportive of what we're seeing, community transmission. And I know it's been said by many that CPS doesn't have the data to support these claims, that we're fear-mongering. But on the contrary, we base our decisions and our advice and our public reports on the data that we are gathering by each individual case. And so our interventions that we have put forward, based on what we're seeing in these clusters, are based on our data, they're based on international evidence, and they're adapted to our local context. So I will say right now, we are currently managing 10 active clusters. And this, to be honest, is across the community, across various sectors. We are seeing clusters in households, we are seeing clusters in the marine industry, in the medical sector, in the restaurant sector, in the justice sector, in various office spaces. And for me, what that is an indication of is that persons aren't necessarily adhering to the public health measures. I've said this time and time again, I know it's hard to wear a mask when you're at work among your colleagues, but this is the tried and true way to prevent transmission. We say wear a mask because there is science that backs the fact that we're saying to wear a mask. There is a reason behind that. It's not to say that we want to inconvenience somebody. And so what we are seeing when we do these investigations with these clusters is that, 1 or 2 persons are exposed at work. They're not maintaining the public health measures. They're in turn going home to their families, interacting with their families, a cluster brews in their household, and it just continues. So unless we break that chain of transmission, so to speak, and really reinforce the public health measures, we will continue to see clusters. We will continue to see community transmission. And so, again, I'm not trying to target one sector. When we identify clusters, it's a testament to how meticulous we are when we're doing our source and contact tracing.
Yes, so you were just listening to our epidemiologist talk about clusters. And why would I bring this back up now? Exactly what she was referring to last year is happening at this time. We are experiencing clusters throughout the island. So it is not isolated to nightlife. It's not isolated to any one sector. It can be everywhere, and it is everywhere. So it behooves us as a country to know our status, to in fact be vaccinated, because we're seeing so many clusters in areas where even in the daytime we are moving. However, we do not want to stop our movement and infringe upon the possibility for persons to be able to earn a living or for us to be able to have a normal life. As we all know, COVID-19 isn't going anywhere. What I'd like to focus on now is that we look at another guest that I have had back in season 2, episode 3. Apart from the rollout, what are the efforts St. Martin has been making to promoting the vaccine? For that, we had someone from the VMT, which is the Vaccination Management Team, Mr. Bart van der Meijden. He is the Communications Officer and Public Engagement for the Vaccination VMT. Let's hear what Bart had to say.
So far we mostly did our communication online via the channels in the newspapers, etc. And what we saw now is that the 60 plus category is still a little bit low, which in a sense makes sense because a lot of the older folks aren't that tech savvy.
Right.
So what we're planning to do now is to print a lot more. We have an information flyer with all the relevant information about the vaccine, which we'll print. We've planned a active outreach, so we plan to go into the neighborhoods, reach out to those people in different languages as well. What else? Distribution. We're gonna put up different stands at the community help desks where people can go to ask information, ask questions, but also to register there because it can be a hassle. We know, and we try to make it. And we try to make it as easy as possible. And we also want to encourage everyone who knows someone who is struggling. So if you have a neighbor or an uncle,
to help them,
just offer to help.
Yes.
Hey, do you want to? And maybe I can help you. Maybe I can help you register because I know how to work with a phone or a tablet. Mm-hmm. Maybe I can even drive you to it. Sometimes the logistics is an issue. We're hoping that not only us, but also other people in the community and maybe also organizations take ownership of the big campaign and the quest that we're all dealing with.
So that was our interview with Bart van der Meijden of the VMT, the Communications and Awareness Manager for the vaccination rollout. We had expected to end this by July, but as you know, our Minister of VSA continued with the vaccination rollout, and we have been having vaccinations which continue at CPS from Monday to Friday. So you can go there, register, and get your vaccinations right away. And then, of course, look out for the pop-ups, which happen every other Saturday. Testing also continues, no longer at the point-blank location, but now you can go to the community help desk that we were just talking about, the community help desk in Hope Estate, where you can still get your testing done. And that is being highly recommended by our minister and the Council of Ministers as well, as a way for us to know our status so we can protect those around us. So whether you're vaccinated or not, test yourself anytime you feel you've been in a situation or you have symptoms and signs that you may have COVID-19. This is my attempt as Prime Minister to ensure that you are reminded of the facts that are supported by evidence and science, and come right back. We'll be right back with Prime Minister Talks.
Prime Minister Talks with Honorable Prime Minister Sylvaria Jacobs.
All persons, even those who have received a COVID-19 vaccine, must continue to maintain physical distance, wear a mask to protect themselves and their communities, and thoroughly wash their hands. Patience is key and commitment is essential. The ability to keep each other safe and healthy is literally in our hands.
Hi, I took the vaccine. Ik ben gevaccineerd.
I took the vaccine.
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 I took the vaccine. Me vacuné. Vacúnate.
I took the vaccine.
Oui, j'ai pris le vaccin.
I took the vaccine.
Moi prends un vaccin. Hein?
I took the vaccine.
Be part of the solution. I will do my part.
Prime Minister Talks with Honorable Prime Minister Sylvaria Jacobs.
If you're just joining us, welcome back to PM Talks. I'm Sylvaria Jacobs, and today I am highlighting some very important information that has come through this program over the past year and a half. We highlighted epidemiologist Eva Lister de Weaver, as well as VMT Communications Manager Bart van der Meijden. In this second portion, we're looking at a very important conversation I had with medical immunologist Dr. Ashley Duits. Listen to what he had to say specifically about the secondary impacts of COVID-19.
Of course, there's are things we are learning right now. As you can remember, this virus, we only know it for a year and a half. So now from science and data, we're learning a lot. We're now learning that in 10 to 15% of persons that have been infected, so not only persons with sequelae leading into a hospital or having complications, but also asymptomatic, about 10%, even after 6 months, have still some complications of the infection, either be it pulmonary problems, so they can't breathe right, they still have aches, they still have headaches, they still have a loss of smell, they still have a foggy mind, they have neurological or psychological problems, they can have kidney problems, they can have heart problems. So again, if you're looking at the risks to take and you're evaluating taking the vaccine, do not only focus on the, I would call them the short-term COVID complications you're seeing. There are other complications that you also need to put into perspective, because those are also COVID related, and even after 6 months. So in order for you to have your own risk assessment, please take those into account, because that's also going to be a burden, not only for you as an individual person, but it's also going to be a burden for the community, because you need to treat those patients. And we see already in the United States, very special centers are being used now for long-term COVID. So that's something to take into account, definitely.
One of the reasons I thought it was so important to bring back Dr. Professor Ashley Duits, who is an immunologist. So this is what he studied, this is what he practices, and he is stationed in Curacao, but has assisted St. Martin also with workshops and bringing awareness and in giving information from a scientific background, is because a lot of us are focused on who's getting ill or who is dying, but we're not looking at all those people who have had COVID-19 and continue to suffer, continue to be sick, or now are in a more deteriorated state of health than they were prior to having COVID-19. As a matter of fact, my two following guests that I'll be highlighting, who I spoke to as well, are persons who had COVID-19, and you'll be able to hear their stories directly. But what I'm asking the people of St. Martin, I'm asking you to do, is think about, even last evening, leaving the government building and speaking to one of the employees who still is a little wary about the vaccination, and mentioned that he was afraid. I am saying to you, 95% coverage is not 100, but I prefer those stances than to be open wide, and especially if you have underlying diseases and other health issues, definitely being at risk to die or have serious underlying issues after. So the risk we are running with not taking the vaccine is much higher than the risk that you have by taking the vaccine. So I want you to take a minute to listen to also a well-respected member of parliament, Mr. Kuki Bijlani, who was one of the first persons I saw go public with the virus. There's also the stigma that people are hiding that they have the virus, or hiding that a family member had the virus or passed with the virus. This also poses a threat because we're not seeing the reality of the effects of the virus. And Mr. Bijlani agreed to have the interview to share his experience, including the long-term effects that COVID-19 has had on him.
August 2nd morning, as soon as I got up, I went to the restroom, I put my monitor, and it was 89. I called him up. I said, Doc, he said, rush to the hospital. I said, I'm positive COVID. How can I rush? So he sent me an ambulance, called the ambulance, and I got the ambulance. They came, they checked me, they rushed me there. After that, 28 days I was in the hospital.
Wow.
The first day, they put me there. CT scan, all those things they did. They say, Cookie, tomorrow you're going home. Nothing to worry. Don't take stress. You're okay. Fine. One day, next day I said, Doc, can I go? Because I was active, doing everything in my room. And that time I was in the St. Martin Medical Center. The nurses were there, catering to all my things, whatever, at least food and everything was there, perfect, nothing to worry. And then the doctor says, no, you can't leave today. I said, why? I'm okay, let me go home. Your oxygen is not getting balanced yet, so you stay. Then started to deteriorate. August 2nd till the August 12th, I was deteriorating. Every day the oxygen level used to go down, and every day Dr. Kairash from the AMI and his other associates, because by the time I was moved to the tent, they wanted to put me on ventilator. But he was the only one not putting me on ventilator because he was seeing me very active, doing exercise, dancing to music, eating my proper meals, doing my
breathing.
Everything I was doing. So he says, no, not today, let's put him tomorrow. But they were giving me strong steroids and other medications and blood thinners and all. So they were trying to keep me balanced over there. And then he decided and told my wife on August 12th, if he doesn't get better from today, then I'll put him on ventilator. Luckily, August 12th, that was yesterday, my wife's birthday, I got a good gift. Instead of she getting a gift, I started to feel better. August 12th is when I started to get better, but August 27th is when I came out. The life, 27 days, what I've gone through there, I want to wish people who are watching, please don't take COVID lightly. It is not a myth. It is nothing, but it is a deadly virus that can take lives. Numbers have proven. We have lost 39 people in our community. And every one of them who we have lost was dear to someone, a friend to someone. There is no difference of vaccinated, not vaccinated. You all stand correct in your thoughts. But just make a point that the person you are meeting, you don't know if he's vaccinated or not. Follow the protocols. Be vigilant. Normally, when we get home is where we drop the guards. And at that time, you don't know your family member who has come, where he is gone, who is he met. Might be the family member who has come from somewhere else. He's strong and he could take that virus. But a weaker person like me might not be able to take it and he will transfer it to me.
Right.
So better to keep the whole community safe and sound, maintain the protocols. Government is releasing protocols every day. Try to keep up with that.
If you were listening clearly to MP Bijlani, you would have heard him say we were at 35 cases, and that was a month ago. As of September 2nd, we now have 56 persons that we know of that have passed as a result of COVID. If you do the math, over the month of August, we are up to about 20 persons that have died, including the 2nd of September. That is way too many persons. And about 95% of those persons have been unvaccinated. That is clear data that nobody can dispute. Majority of these persons also had underlying issues. Not majority, all had underlying issues. This is a very sad situation for the people of St. Martin, for their loved ones, and all who will miss them for eternity. We must do something to protect ourselves and the people we love. And the medical center itself, because there are so many cases to deal with, are having to scale back on their procedures, etc. So procedures that may not be urgent are not being done, they're being postponed due to the high level of care needed for so many COVID patients. The numbers are fluctuating. There are currently 15 people in hospital. We do have a capacity of 12 on one side and 16 on the other, but that still is at our maximum. So I'm asking you, as MP Bijlani said, follow the protocols and do what you can to protect yourself, including getting vaccinated. So we can hear a bit of what SMMC is doing from season 2, episode 12.
We are scaling back with elective surgeries. So elective surgery will be put on hold until we are just looking at the numbers. Because if you have so many cases out there, you got to take a 10% that can be admitted. And from that 10%, you could take a next 3% that are going to be intensive care patients. Ooh. So we are scaling back on that. So right now, the normal non-COVID, non-routine patients, we've scaled back on that. And that was also our motto in the beginning. But now we notice that this is a reality. Because if we look at the amount of COVID patients that are coming in, thank God we decided to scale back in advance. Mm-hmm. Because now you have to use those same areas. We have the ACF, doing a wonderful job. It's the MI, the team of MI. And in the beginning, they were not that busy. But if you look now, they could have 6 patients on a ventilator. And up there have 16 beds. Mm-hmm. And whereby they used to have 6 patients. Now you notice that they have up to 8 or 10 patients in it there. So we have to take the brunt. Everyone that comes now have to come to St. Martin Medical Center. We have made offices and rooms that you couldn't put patients. We have rebuilt those to put patients in and had to modify a lot of areas. Okay. And one of the next thing we did is the visitors. We also cut down on visitors drastically. Once the COVID cases are going up, we are going down with visitors. Okay. Again, you cannot control who all is coming to the hospital and who's coming in and out. And everyone tried to get in. But now what you notice that it's on the rise and people now, they're scared to come to the hospital. Remember, a hospital is a place where you get all the kind of acquired infections and things. And COVID is no different to any other infection.
It's a super infection.
Yes.
The stigma that is still there. I've recently been exposed in a sense of someone who was in my area, spent time with me 2 to 3 hours. The following day tested positive. And everyone who was in the gathering at the time, though it was a small gathering, was in a panic. But one person in the whole group was not vaccinated. We notified, they said the vaccinated persons just need to monitor themselves. And of course, if you have to go out, wear a mask, do these kind of things. Everybody monitored. Test in the first 3 days. After the 3-4 days, majority, if not all of us tested, and everybody tested negative. But just the few days of not knowing can put a lot of stress on you.
Sure.
Another case I saw today, over the weekend, just the thought that they were exposed to a positive case, the person had headache, the person feels nauseous. And I'm like, I can't use headache as a gauge. And that's something that is now prevalent as well with Delta. A lot of people are saying the first thing they experienced was headaches. Are you noticing anything like that? And what can we do to encourage people to come forward and at least be tested to rule it out?
It is a stigma to a lot of people, especially before time you had CPS coming to your house. I knew of persons who told us that they hid when the CPS reached because they don't want the neighbors to see CPS coming to their house. And now it makes it easier because now you have to call. So a lot of them would not call CPS because they don't want anyone. They have people telling me, oh yes, I'm in quarantine. No, you're in isolation, you have COVID. They will tell you, I'm home in quarantine because I was in the air with someone who had COVID. That time they have COVID. I think people have to look at this, take it serious. It is good to be able to, I'm sitting down here talking about it now, but we have many of others who lost their lives, especially those with comorbidities, underlying issues. Take it serious. Speak to your doctor, see if you could get tested. Because if you get the vaccine, we have not have proof that the vaccine kills. you with your underlying areas, but we have proof that COVID kills you with your underlying areas. So you have to determine how you're going to go about it. Keep the stigma aside. Get the stigma aside and put it in your mind that I'm going to be very egoistic. I got to help myself first.
Well, I must say it has been a bit of a, how you call it, roller coaster with COVID over the past year and change. We have actually fared better than we expected in the first couple waves. This last wave is taking a toll in terms of deaths. We have had, I know what Minister said on Wednesday, 8 deaths in 9 days. That was very, very hard. But I have said to the people, 40 deaths is 40 deaths too much.
Too much. That's right.
So we're coming to the end of the program, but there will be more opportunities for us to share with you, share information with you. But I'd like to take this time to honestly encourage people to look good at the data. 95% chance protection is a chance I will take. I have taken. And thank God I've been exposed twice in the past month to a person that has been positive and both times tested negative. I mean, tomorrow I might not be so lucky, but what I'm doing is continuing to wear my mask at all times, especially when I can't be. And if you check between Tony and myself, we got 2 meters distance. We are not within the space. None of us are exhibiting any flu-like symptoms to cough on each other. So protect yourself. Ensure that you are protecting yourself first at all times and get healthy. This is something we preached last year. Get healthy, and in the next few episodes, we'll be focusing not only on bringing you information about COVID and what can happen to you, but ways for you to get healthier. So this is Prime Minister Jacobs signing off for today and wishing each and every one a safe weekend, but also continued protection for yourself and your family. Look up our websites, get vaccinated, and get tested as often as you feel you've been exposed so that you can protect others, because some of us are asymptomatic and still able to spread this virus. Thank you for following this program, and until next time, this has been Prime Minister Talks.